this is a lecture on the axial skeleton, and you're going to want to have your axial skeletal bone list with you so you can take notes on that. And I will be really picking out the features that are on that axial skeleton bone list. That is what I expect you to know for our lecture exam, and I'm sure your lab instructor will have a note sheet that will be very similar on the things that you're expected to identify. For lecture, I expect you to know, if I ask you in a word type of question, what feature is on the maxilla, or what hole or foramen is on the maxilla, you should be able to point out it's the infraorbital foramen. You should know what features are on what bones in a word format. So without looking at the skeleton, still know where these things are located. So the skeleton is divided into two sections, and one is the axial skeleton. So that's really the head and vertebral column. So the cranial bones, the facial bones, the vertebra, all the way down to the sacrum and coccyx. And then anything attached to that, which would be ribs and the sternum in the front. You also have the floating bone called the hyoid, and that is up kind of underneath your mandible, and it floats attached to ligaments around your trachea. So that's the axial skeleton. Appendicular skeleton is really the appendages. So pectoral girdle and pelvic girdle, and then upper and lower appendages or limbs. So the axial skeleton, again, we're going to look at the skull. Auditory oscles, these are little bones in the middle ear, and we really talk about these when we get into the sensory special senses. Hyoid, as I described, that's that floating bone. The vertebral column and the thoracic cage, which includes your sternum in the front, and then the appendicular skeleton are the pectoral pelvic girdles and the limbs. So this diagram gives you kind of an overview, and really the meat of the axial skeleton is going to be in the cranial and facial bones, and then really your vertebra sacrum. There's a little bit in the sternum, tiny bit in the ribs. Auditory oscles, hyoid, and ribs are just kind of a FYI. We go over them. Not a lot of features to memorize on that. So the function of the axial skeleton really is supporting kind of the axis of our body. So that is the long axis by which we can move our muscles around. And it also protects super important organs like your brain and your spinal cord, that is all of the nerves coming and going from the rest of your body to your brain, which controls most things that are going on. So that's the protects, right? Protects special senses. And it's also this attachment site for our trunk, head and neck muscles, and respiratory muscles. And then it really is a stabilization. Like I said, it's the long axis by which our appendages can move on. From, to, on, etc. So let's start with the cranial bones. The cranial bones, you have one frontal bone, you have two parietal bones, there's one on each side. You have two temporal bones, there's one on each side, and you have an occipital bone. Now the lesser known bones are going to be the sphenoid and the ethmoid. So we'll talk about those. These are a little bit lesser known to people and a little bit more difficult to visualize. The facial bones, we have the nasal bones, that's your nose, bridge of your nose. The lacrimal bone's a little bone that kind of makes up the, basically the lateral sides of your nasal cavity into your orbital or eye sockets. You have the zygomatic bone, which is really your cheek. You have your maxilla, which is your upper jaw here, and then the mandible, which is your lower jaw. Those are the main ones. The vomer is a little bone that kind of makes up your the lower portion of your nasal septum, or the separator of your right and left nostrils. You have the Palatine bones and the inferior nasal concha. These are littler bones. Palatine is your upper, there are two little bones on the upper roof of your jaw. We call it your hard palate. That's made of bones, and then your soft palate is made of cartilage. It shows you the hyoid bone and the little auditory ossicles. Now, the cranial bones have what are called sutures, and sutures are articulations. We'll talk about articulations in chapter 8, but there are articulations are where two bones connect, and sutures are immovable articulations. They don't move. It's where two bones come together and they produce no movement. So it's synarthritic, meaning no movement. Again, we'll go over that in chapter 8. And there are a few sutures, most notably the coronal suture, that's kind of in the front. And that's a suture between the frontal bone and the two parietal bones. The sagittal suture kind of forms a, if that's coronal, sagittal forms a kind of a right angle with it. So sagittal would be that one, and coronal would be that one. And so it's between the two parietal bones. Obviously, the sagittal suture really goes in the sagittal plane. And the coronal suture is in the coronal plane. We tend to call the coronal plane these days the frontal plane. So they reside there. The lambdoid suture, it kind of looks like a lambda, the Greek letter lambda. And this is between the occipital bone, which is there, and then a parietal bone on that side and a parietal bone on that side. So that's a lambdoid suture. It is posterior. The squamous sutures are lateral. So there are two of these, two squamous sutures. And this is between the temporal bone and the parietal bone. So you're going to find these on the lateral side of skull. The frontonasal suture is the suture between the nasal bones and the frontal bones. And so you're going to see there's two little nasal bones like that, and then the frontal bone here. And so it's just looking at that. So this shows you the sutures. Again, the coronal suture is here. It's in the coronal or frontal plane. And then the sagittal suture is here. If you look posterior, right? So this is posterior and this is superior. And so you see the kind of lambdoid suture here. And then on the sides, here we have the squamosal suture there. There's the frontonasal suture here, and here's the two nasal bones, and this would be the frontal. So you can see the different sutures, and you need to be able to identify which bones they connect. Moving on to the occipital bone. So there's a number of things, the foramen magnum, occipital condyles. We don't go over the basio-occipital bridge of the foramen magnum, so you don't have to worry about that. That was included in this PowerPoint. We do go over the external occipital protuberance and crest, but it's not on my list. So I'm kind of going to just do that. I'll show you where it is. And the inferior and superior nuchal lines, I do not have on my list, but I will point those out. And I do have the hypoglossal canals. Condylar fossa, I don't, but I'll point those out as well. So the occipital bone, and so this is an inferior view. Again, you always want to make sure that you orientate what you're looking at. And so this is the occipital bone here. And so you have the external occipital protuberance, and I'll highlight that here, and that's that bump. You're going to have lines here that are superior and inferior, and those will be the nuchal lines, but that is not something that I go into detail on. What I do want you to take note and is things that you do have to know are the occipital condyles, the foramen magnum, the hypoglossal canal. And let's see, what am I forgetting? And those are the three main things. So let's go over those. Let's see, we will do this in pink. So the foramen magnum here is where the spinal cord, it's the hole where the spinal cord leaves the cranium. So it's a large hole. Foramen is a hole through a bone. Remember, foramen is always going to equal basically hole through bone. And it's a large one. So that's foramen magnum. The hypoglossal canal you cannot really see in this view. But first, I'm going to talk about the occipital condyle. So this right here is the occipital condyle on one side, and here's the occipital condyle on the other side, right? So there's two, and I'm going to put the other arrow here. So condyles, again, are rounded ends of bones that articulate with another bone. And so these condyles are rounded. So we're looking at the inferior view. So if we turn it over, so this is pointing down. These two condyles right here articulate with the first cervical vertebra with C1, also known as the atlas bone. And that is our first cervical vertebra. Now, this is inferior. What is right above this occipital condyle, and it is a hole that goes from here. Let me make this a little bit more obvious. It goes from here. And so this is the hypoglossal canal here. So it's a hole. So hypoglossal canal is basically a hole where the hypoglossal cranial nerve comes from out of our brainstem and where comes out below our tongue. And it is a hole that is located above the occipital condyles. Okay, so it's above the occipital condyles. It is lateral to foramen magnum. And the occipital condyle is also lateral to foramen magnum. So that kind of orientates you a little bit on what you're looking at. So we'll come back to that picture when we get to some of the other views. Parietal bones, there's really nothing. I don't go through any of this. In terms of knowing it, you can read these lines. They're generally where muscles or something's attached. But no serious questions on that. And so, again, this kind of shows you the occipital protuberance here, and the parietal bones. Okay, so frontal bone. A couple of things that we're going to talk about on the frontal bone is really, we can talk about the supraorbital margins, but really the supraorbital foramen is a big one, and the frontal sinuses, understanding, because a lot of people have sinus infections. It's important to go over that. But this is really the big one here, and this one. These are the two I care about. So the frontal bone is here, and there's not much to write home about, but you do have a space right here. So there is a space or cavity inside the frontal bone. So you can't really see it. It's inside the bone, but it's filled with air. And this is what a sinus is. So a sinus is a cavity or space that's filled with air. Okay, and so this helps. These holes or spaces are interconnected. There's one in the frontal bone. There are two in the maxillary bones in here. So these would be the maxillary sinuses. So maxillary sinus. And then there's some behind your nose in the ethmoid and sphenoid bones. And so they're all interconnected. There are all these spaces inside the bones, and these are your paranasal sinuses because they are all connected with the nasal cavity. And these spaces lighten the load of your skull, but also enable you to resonate sound. They're like little caves. And so when you have a sinus infection, it usually arises because you have an upper respiratory infection and your nose produces a lot of mucus in the mucosal lining. And that mucus, if it's not blown out or there's too much, it starts to go back into those cavities or spaces, those paranasal sinuses. And that's why you can have pain here, you can have pain in here and there. You can have mucus dripping into your pharynx from your nasal cavity, from the sphenoidal or ethmoidal sinuses. And when they're packed with mucus, they hurt. They also make it hard to resonate sound, so your voice sounds muffly. And they can also grow bacteria because that mucus is not circulating, so we get infections in there. So it's important to understand these paranasal sinuses. Other things, you know, the way that the book sets up this lecture, I'm used to teaching it in person. And so I've realized that having your list, super important. And I'm going to go off my memory with the list because I kind of memorize. Well, I'm going to pull up the list myself because I think it's important to go through the list. And so let's do that now. So I'm pulling up my list, and we got the bone list. And let's see, axial skeleton. Diagrams? Nope. And let's see where that bone list is. I'm gonna pause this. So while I'm looking for the bone list, I want you guys to look for the bone list as well. So let's look through and see if we can find our bone list. And I'm having a really hard time. So I'm gonna have to go to my documents and going to, and let's see. All right, so I am pulling up a bone list just so I don't miss anything with you guys. So when we're looking at the inferior view, what I'm going to do is I'm going to highlight all of the things that are somewhat important for you guys to know, or important. So you got the zygomatic bone, you got the sphenoid, mandibular fossa, jugular foramen, styloid process. You can't see the styloid mastoid foramen on our model bone, so I don't usually go over it, but it's there in the occipital mastoid suture. But we go through the Palatine Bone, so I talked about those. Those are these bones right here. The vomer, which is this lower portion there. So I can make it a little bit darker. These are the palatines. And this is the vomer. So not really exciting. They're just little bones. They're there. We'll talk about the zygomatic arch. That's this arch here that forms our cheek. There's the pterygoid processes, of which muscles are attached to move our lower jaw or mandible. Foramen ovale, foramen spinosum, and foramen lacerum, and the mastoid process. So these are all things that are going to be on your list in the view that you see. And so going through them, it's hard to look on the skull, but let's go through them kind of one at a time. And that the sphenoid bone is really this bone right here. It's kind of hard to see in this diagram, but you'll see it in some other ones. So that's the sphenoid. And there's going to be these foramens or holes. And you don't really see the foramen lacerum, which is here. and Foramen Spinosum. So Foramen ovale is this one because it looks oval in shape. And Foramen Spinosum, S is for small, and that's here. That is the most lateral, right? So, whoops, sorry, Foramen Spinosum. It's small and lateral. And then you have the Foramen lacerum here, which is most medial. And it's right next to this bridge here. So these are the same on this side as well. This is the Foramen ovale, and this is the Foramen spinosum, and that is the Foramen lacerum. So they're on both sides. The styloid process you can't really see, but it is a pointy thing here, and there's a pointy one over here. They project off the temporal bones. It looks like a stylus. So a stylus that you write on. So I'm writing with an Apple pencil right now. It's got a pointy end, that's a stylus. Styloid processes really do look like that. They project down off the bone, and I'll show you in another view. The mastoid process is here, and I think here. You can feel your mastoid process. It's like this chunky triangular piece of bone that projects off the temporal bone. If you go to your lower jaw has an angle, your mandible has an angle, and you go up behind your ear, you feel this bone that kind of drops down. That's your mastoid process. So we'll go through that. And then zygomatic arch I'll show you as well. So looking from the side, I was talking about your mastoid process. So here it is. Here's your styloid and mastoid process and your external acoustic meatus. Lambdoid suture we went over. I'm showing you your sutures and the squamous. And let's talk about your zygomatic arch. So these are the zygomatic arches. So the mastoid process, you have one on each side. This is your mastoid process. And so this is showing you this. It's this process or projection off the bone. Unfortunately, it's still not really a great view for the styloid process. It's got this dark little view of a process that sticks out. The other mastoid process is there. And then the styloid process is here. And so when we get together, when we do our Zoom time, I'm going to have some bones that you can see over Zoom, and also I'll show you these over Zoom so you can see them a little bit better. Your external acoustic meatus, or external auditory canal, as it's sometimes referred to, as is your ear hole, right? It's a real fancy way of saying that. Now, this is your zygomatic bone, and this is your temporal bone. And they have two processes or projections that form the zygomatic arch, right? So the zygomatic arch is this right here. So it really does form your cheek. It's this arch right here. And there's actually a space or hole that can go through on the other side. So it's hollow. So this is your cheekbone. The zygomatic arch is really your cheekbone. And it's part temporal bone and part zygomatic bone. So if you could see, there's a little suture right here, and this would be zygomatic. And then on this side, this process right here is going to be temporal. And so the process that projects out here is going to the temporal bone, so it's called the temporal process of the zygomatic bone. And this process right here that goes out is referred to as the zygomatic process of the temporal bone because it's of the temporal bone, but it's connecting to the zygomatic bone. So those two are going to make up. So these two together make up the zygomatic arch. Another thing that we're going to talk about is the mental foramen. Foramens, again, are holes through bones. And so in this case, let's look, you have a hole here. It's in the mental, anatomically named the mental area, and there's one on the right and one on the left. So there's two total. And this is where nerves can come out. And so you can feel the skin and work the muscles down there in the front of your mandible. And so those are on this view as well. On the front view again, you have a mental foramen here and a mental foramen here. So there's one and there's two. So those are the mental foramens. Got mental foramens. Mental protuberance is just here on the chin. This is showing you the vomer and the perpendicular plate of the ethmoid. They make up your bony nasal septum. The inferior nasal concha are little bones. They get their own names because they are little bones. The middle nasal concha and superior nasal concha are parts of other bones, so they don't get their own name. What else do you need to know on here? Well, here's the lacrimal bone and the superior orbital fissure, the optic canal, the nasal bone. And then on this side, supraorbital foramen and infraorbital foramen, besides the names of the bones. So infraorbital foramen, again, foramens are holes through bones. Let's make those a little bit different color. We'll make them these. And the infraorbital foramen is there, and there's another one there. Infra. So when you kind of break that down, infra refers to inferior. This is the anatomical name, is the orbital area, right? So it's inferior to the orbital area. And it's a foramen, which is a hole through the bone. So you don't really need to memorize these things because the name a lot of times is telling you location. It's inferior to where? The orbital area, and it's a foramen or a hole through a bone. So that makes it easy when someone says, hey, where's the supraorbital foramen? Well, it's going to be superior to the orb. To the orbital area, and it's a foramen or a hole through a bone. So those are kind of easy, easy pickings. The nasal bones are here, got two, and then the lacrimal bones are off to the side here, and they kind of make up this lateral bone here. And there's a little hole of which tears drain called the nasolacrimal canal. And so that's how you get tears to drain into your nasal cavity here. So that's that. The ethmoid bone has what's called a nasal septum. So this one, the ethmoid bone is actually up here, and there's a septum that drops down. And so this, it's perpendicular to the main plate of the ethmoid bone. And so it is referred to as the perpendicular plate of the ethmoid. The lower portion that goes in the same direction here is the vomer. And so the vomer just kind of makes up the lower portion of that perpendicular plate, or what we refer to as our nasal septum. Now this is looking, if we took the cranial cap off, the top of your skull off, we're looking down at it. So this is really a superior view of the skull. It's just open to us. And you get a different view here. So here's the sphenoid. Kind of goes like this and around, right? Like that. And so it does kind of take up most of the middle cranial fossa. Right, so this is going to be the sphenoid. It kind of looks like Batman, like you're calling for Batman there. And things on this view that I can point out is that frontal sinus. Remember, I was talking about the fact that there's space or hole in the frontal bone. It really is along that side. The ethmoid, this right here is the top of the ethmoid bone. So that is the ethmoid. And this is the sphenoid. The ethmoid bone has two features, the crista galli and the cribriform plate. So the crista galli is really this part that sticks up on the ethmoid bone, and the cribriform plate is really the basement or bottom plate area here, and it has dominated by a bunch of holes. Those holes are foramen. And so on the cribriform plate, you have olfactory foramina. So foramina is plural for foramen, so lots of holes. So these olfactory foramina. You have your cranial nerves for smell that are there, and the receptors drop through the olfactory foramina to the inside the roof of your nose. This is right above your nose, right? So the ethmoid is the top of your nasal cavity. The sphenoid we don't really see because it sits behind your eyes, right? So you have eyes here. Erase that. So one of your eyes would be here and the other eye would be here. And so you don't really see the sphenoid bone. It's kind of in the middle of your skull. We don't get a great view of it, generally speaking. The sella turcica, foramen lacerum, foramen spinosum, and foramen ovale we saw in the inferior view, but we can see them in the superior view because they're cranial nerves that are go through these holes to get out of the cranial cavity. And other features that we're going to talk about are jugular foramen, foramen magnum, we see the hypoglossal canal, and we could talk about the the carotid canal. So these are things too that you can see. So let's start with, again, you have foramen spinosum. So that is the smallest one, and that is here. And it kind of shows it here. So those are foramen spinosum. So I'm going to make them blue on both sides. And then we have the foramen ovale. It's the one that's oval. So I'm going to make that green. And then we have the foramen lacerum. Let's make that purple so it's different. And the foramen lacerum is this one right here. And so basically the way I would teach it to you in class is foramen spinosum is lateral. Spinosum starts with an S. And then the next one over is ovale here, right? And that starts with an O. And the one that's most medial here is lacerum, and that starts with an L. And so if you remember from lateral to medial on both sides, so that's most lateral, middle, and medial, right? So it's S-O-L. I don't know if you guys know what S-O-L stands for, but it stands for shit out of luck. So you don't want to be shit out of luck. You remember that it's spinosum, ovale, lacerum. And that is surrounding something called the sella turcica. So what you can't appreciate in this is there is this kind of indentation here called the sella turcica, or Turkish saddle. It's where your pituitary gland sits. So your pituitary gland is there. Okay, so it's there in the sella turcica. And then you have these little processes in the front here. They stick out like this, and those are called the anterior clinoid processes, right there and there. And then you have these ones that stick out in the back, and these right here would be the posterior clinoid processes. So you have those. In the sphenoid, I always say it's like riding a motorcycle. You have handlebars here. And then right on the sides of the handlebars, you have these two holes or canals. These are the optic canals. So you can see, think of them as your headlights. And these are your handlebars, these anterior clinoid processes. You sit in the sella turcica and you lean back on the anterior clinoid processes. It's kind of like a little motorcycle structure if you look at it in person. Other things, you have the jugular foramen here. There's another jugular foramen there. You can see it better on that side, I think. And we have the foramen magnum. That's there. We have the hypoglossal canal, which you can't see, but again, it's above what would be the occipital condyle, which would be there. And then it's above that on the sides of the foramen magnum. So it's kind of hard to see, but there are holes there. And I think I covered everything on this. So looking through this, when you see stuff, and I haven't gone over it, you know, squamous part, I did go over zygomatic process. I did go over temporal process and zygomatic arch, right? External acoustic meatus. You can't see the tympanic membrane. We'll talk about that when we get to special senses. We did not talk about the styloid mastoid foramen, but we talked about the styloid process and the mastoid process and the jugular foramen. All right, so we've talked about all those things. Foramen lacerum, you can see, you can't see these things. So we're not really looking at those. The carotid canal, by the way, is on the inferior view, is really where you can see it. So I really haven't had a good view of the carotid. Oh, and we do have a view of the carotid canal. It's a little canal here. Associated with the jugular foramen, there and there. But it's not on my list. If it's on your list for lab, again, it's a canal here that leads to, this is the jugular foramen. Oh gosh, I'm like way off. Carotid canal, the foramen. I'm not sure this is lining up appropriately, but there you go. Okay, so sphenoid, talked about the sella turcica. That is the most important, the anterior and posterior clinoid processes. The foramen rotundum. Now, I didn't get into the foramen rotundum because I didn't see that it was visible, but there is a round foramen here. It is the foramen rotundum. And so you can't really see it well on these diagrams. If I come across it, I will show you the foramen rotundum. Optic canal is where your optic nerve goes from your brain, or from, I should say, from your eye into your brain, right? So your eyes are on one side, on the outside in your orbital area, and the back of the retina converges to the optic nerve, and that optic nerve goes through the optic canal into your brain. We did not necessarily go over the greater and lesser wings of the sphenoid. These are on the inferior view only. And when I get a chance to show you with the real skull, I will point those out. We did go over foramen ovale and foramen spinosum. These are holes in which cranial nerves go through. And so when we talk about nerves, the nervous system, cranial nerves, we'll talk again about all these foramens and holes, as we'll describe where they're coming through. So again, foramen rotundum doesn't show up real well on this diagram. And now what these do is they break these out. So this is the sphenoid bone. And this is superior. So this is the sella turcica in here. It's kind of showing you the optic groove, but more importantly, the optic canals are here. And then you have the anterior clinoid processes that stick out. And then it's showing you the foramen ovale, foramen spinosum, and the foramen lacerum is kind of broken out on those sides. So it's showing you those things. Here's the Foramen Rotundum. It's kind of tucked away under the anterior clinoid processes. So the anterior clinoid process goes out, and the Foramen Rotundum is kind of tucked up under here. It's a little hole under here, and you can't really see the one. It's up under there as well. Ethmoid, you're going to have the crystal galli on top, right? So that's on top, superior, and it's on the cribriform plate. And then the perpendicular plate, again, if the cribriform plate and crystal galli is up here, the perpendicular plate drops down through your nasal cavity. And we didn't really go over this. Ethmoid also has a superior and middle nasal concha in there. I did mention cranial fossas and that the sphenoid makes up most of the middle cranial fossa. Fossas, again, are shallow depressions. And so you have an anterior, you have a middle, and then you have a posterior cranial fossa. And that's where your brain sits. So this just kind of goes through the parts of that. And those are the cranial bones. So bones of the face, you have a few things. I pointed out the inferior orbital fissure. Oh, I have not pointed out the fissure. I will point that out. Talked about your maxillary sinuses. So let's go through what you can see there, right? So your infraorbital foramen. Remember, supraorbital is a cranial bone. So they're kind of separating it out. Like that's cranial bone, and now we're on facial bones. So facial bones are going to be the maxilla, the mandible, the zygomatic bone, and then inferior nasal concha. These are really the facial bones. They include the lacrimal and nasal bones in that. You have your mental foramens here, and you have your infraorbital foramens there. Your supraorbital foramens up here. Again, your perpendicular plate of the ethmoid, and then the bottom part is the vomer, making up your nasal septum. So this just goes through the bones of the face, the little palatine bones, the nasal bones, and the inferior nasal concha. We have somewhat of a squished view here, but this color coats these bones so you can see. So the purple is going to be sphenoid, and the palatine's yellow, and the maxilla is orange. And so this would be your hard palate. So this is what we call the hard palate. And palate, I can't spell. And so this would be soft. And it kind of shows you, like styloid process, for instance, it kind of shows you a little bit better how it sticks out here and here, right? So it gives you a little bit better view of some of these things because they're in color, but goes through zygomatic. And again, I didn't go through zygomatic or zygomatico-facial foramen. I did talk about the nasolacrimal canal and the vomer making up the bottom part of your nasal septum. So it's good to go through these. And you can see, you know, again, vomer is this little part, inferior nasal concha is a separate bone, but middle and superior are included with the ethmoid. So it breaks it down a little bit easier to see with color. A few other things I want to point out. So you are going to have the optic canal. And so the optic canal, they're kind of showing it here as this perfect circle, but you also have these slashy big holes here in your eyes, okay? So this right here is the optic canal. This right here is called a fissure. So the higher ones, fissures are kind of long cracks. And so the higher one is the superior orbital fissure. And the lower one here is going to be your inferior orbital fissure. And again, more cranial nerves coming from your brain to control eye muscles are going to go through these big fissures to your eye to control those eye muscles. As far as the mandible, things that we're going to talk about, I'll talk about the angle and ramus, the condylar process, coronoid process. We talked about the mental foramen. Remember, foramina are plural, so there's 2 mental foramens. We also talk about the submandibular fossa, not so much. Let's not confuse that with mandibular fossa. We do talk about the mandibular foramen. So let's go over these things right here. So these are the mental foramens. There's one on each side. And then on the inside of the jaw, you have the mandibular foramen. So there's 2 of those as well. So there's 2 and 2. Anyone that's had a tooth cavity filled, when the dentist pulls your cheek out and sticks a needle to the back of your lower jaw, what they're trying to do is get at this nerve that goes to your lower jaw here, right? So they're trying to deaden the nerve that services your teeth so they can work on your teeth. It also, so the nerve goes through in there, but it also affects the muscles that those, it's not just pain nerves, but it also, those nerves control muscles. There's motor nerves. And so your face is all droopy in that area because you have also deadened the muscles there. But that is the mandibular foramen. There are 2, one on each side of the mandible. And you can see it over here as well. That's a mandibular foramen, right? So that as well. Other things, so a ramus. A ramus is like the strip of bone with an angle. So the ramus is a strip of bone with this angle. The other things that are important to know is that you have this condylar process or mandibular condyle. And this is what attaches to the temporal bone. So the mandibular, are we not sharing? I think we got cut off here. Maybe my iPad decided not to share anymore. There we go. So the mandibular condyle articulates with the temporal bone in the mandibular fossa or shallow depression in the temporal bone. So the temporal bone has this little shallow depression called the mandibular fossa, and the mandibular condyles of the mandibles sit inside that little shallow depression in the temporal bone. And this is referred to as your temporomandibular joint. Some of you guys may have been told at one point you have TMJ. It's where your jaw hurts, where your mandible goes into the temporal bone. Because it's your temporomandibular joint, we just shorten it to TMJ. So that is this area right there that I'm talking about. And the other part is you have this mandibular notch here. So I should probably start going in different colors here. Right there, that is the mandibular notch. And on the other side of the mandibular notch, you have this little process here and here. And that is the coronoid process. So this right here is the coronoid process of the mandible. If you can believe it, there is a coronoid process on your ulnar bone. So that's why I'm saying it's the coronoid process of the mandible. This just goes through the orbs and all the bones that make up your orbital area. And it does have the lacrimal gland and also the nasolacrimal canal. And so it's kind of showing you here that they're calling it a lacrimal groove and the nasolacrimal canal. So that's where your tears go, tears. It's showing you the optic canal here, and then the superior orbital fissure and a piece of the inferior orbital fissure. The infraorbital foramen and the supraorbital notch. It's not really showing you the supraorbital foramen. This one is going to show you the frontal sinus, and this would be the sphenoidal sinus. It's not showing the maxillary sinus. So this is in the sphenoid. It's a very big sinus. It's also showing you the ethmoidal superior and middle nasal conchas, which is part of the ethmoid, and then the inferior is its own bone. Again, paranasal sinuses, air-filled chambers that open up to the nasal cavity, and it's kind of showing you the placement of all these sinus or cavities and where they're located. It's kind of why if a physician thinks you have a sinus infection, they kind of bang on those areas. Hyoid, I'm not going to spend too much time on, although it's this little floating bone here, right above your thyroid cartilage. And this shows you before the sutures close, you have still hyaline cartilage. And so the hyaline cartilage slowly gets replaced with bone as your brain grows and you grow. All right, so let's move on to the vertebra and go through this. Functions, what it does. You have spinal curves, you have primary and secondary curvatures. So the primary curvatures are the ones you're born with. And the secondary are the ones that you develop, right? So develop as you start to walk. So there's two secondaries and there's two primaries. The cervical vertebra, you have 7. Thoracic vertebra, you have 12. Lumbar vertebra, you have 5. Sacrum tends to be 5 fused vertebra, and the coccyx can be 2 to 5. You know, is your tail, basically. So read through the curvatures. And there's quite a bit on that, and it shows you overdevelopment, how you develop these curvatures as you start to stand up and walk. The weight distribution starts to form those secondary curvatures. Vertebra, there are some things you need to know. Spinous process, lamina, transverse process, superior articulating process and facet, pedicle, vertebral foramen, and these are on a typical vertebra. So I usually learn it by going around the bone. So I always start at the body. And so what sits on the body is your intervertebral discs, right? So those discs are there. They sit on top of the body. And then you have this strip of bone here, starting to form the vertebral arch, and that is your pedicle. So these bones right here are the pedicle bones. So when people fracture their back, they're basically talking about fracturing the pedicle, this bone right here. And as that really holds the transverse processes, which are here, and spinous process, which is here, to the body of the vertebra. So the pedicle holds this part together, and it holds it here. That's what the pedicle does. So I'm going to erase this so I can keep drawing on this. And so pedicles, that bone. Then we have these processes that stick out. And so we're looking at it, and the processes go this way and that way. And this is lateral, right? So this is lateral. Because we're looking at the superior view, or it could be inferior, but I'm assuming it's superior since it says superior. This is the transverse plane. And so these are referred to as the transverse processes. So there's one on the right and one on the left, and they stick straight out to the sides in the transverse process. Spinous process, if I were to tell you to reach around and feel your spine, you would reach around and you would feel your spinous process. That's how you remember it. Now the strip of bone here that connects the spinous process to the transverse process is the lamina. So lamina is bone that connects spinous process to transverse process. And so you can remember it that way. There are bones that stick up and down, and those bones that stick up are the superior articulating processes, and there's one that are lower that stick down here, and those would be the inferior articular processes. The smooth part on that articular process is called the facet. So a facet is a smooth bone area that it's smooth because it's articulating with another bone. So again, this goes through the vertebral arch, and the vertebral arch then forms the vertebral foramen, in which the spinal cord goes through, resides. And so I always say, like, remember body, and then pedicle, and then you have the articulating facets and processes, right? And then you have the transverse process, and then lamina, and then spinous process, and then transverse process, and then another pedicle. Oops, I forgot my other lamina, right? And then you have the vertebral foramen. And so you can just start to learn to label these. This is going to show you a little bit better. So the articular facet, and this is the superior articular process, because the facet is part of the process. Here, obviously, would be the inferior. Now, when you have more than one vertebra together, so these are all different vertebrae, right? So that's 1, that's 2, that's 3. So 2 and 3, 1 and 2, when the articulating processes are on top of each other, so this is superior articulating process, and this is inferior of the one above it. The 2 of them with the intervertebral disc, right? And this is a body, and then you got another disc. The discs maintain this space between the vertebral bodies. And then these articular process also maintains this space. And so this is a hole or a space, and it's created by 2 vertebrae. And so that is called the intervertebral foramen. And that is important because that is where spinal nerves come out. Right? And so you can imagine that if your disc collapses, right, and gets smaller, this hole also gets smaller. And so the nerves have less space to come out. And so what happens is the nerve starts getting hit by the bony structure around it. And that's why a bulging disc or a smashed disc is going to hurt. The intervertebral foramens need to stay a certain diameter in order to let the spinal nerves have enough space to come out. And so spinal nerves are mixed nerves. You have sensory afferent axons coming into the spinal cord, and they're bundled with motor axons going out to your muscles. That's what a spinal nerve is. But spinal nerves come out of the intervertebral foramen. And this is another way you can see the inferior process and the superior process. This goes through spina bifida, so malformation, where the vertebral arch fails to close, so you start having spinal cord meninges come out. The system is such that we just number vertebra from the first cervical vertebra down to the 7th, and then the first thoracic vertebra through the 12th, and the first lumbar through the 5th. Notables are cervical vertebra have something special, and that's called a transverse foramen, or foramina when we're talking about all of them. And that the first 2 cervical vertebrae, C1 is called the atlas, and C2 is called the axis. Atlas is who holds up the world, right? So I believe it's a Greek god who holds up the world. And so C1 really holds up your world, which is your cranial structure, your cephalon, your head. And then C2 actually has an axis. So it's a vertebra that kind of looks like this, and it has an axis that sticks up, and C1 kind of rotates on it, on the axis of C2. So that axis is called the dens, or in some books, it's called the odontoid process. So you'll see that in a minute. So when you're looking at a cervical vertebra, it's the same, right? You have the body, you have the pedicle, you have the lamina, and then you have the articular processes, right? So that would be articular process. And then you also have the transverse processes that stick out, and you have the spinous process. That's the spinous process. And the spinous process has a bifid tip. It kind of, some of them, not all of them, kind of branch like that. But in the transverse process here, you have holes. Those are transverse foramen. They're holes that allow for the vertebral artery and vein to go from your thoracic cavity up to your brain. There's also nerves that are in there. It's just a protective bony structure around vital structures that have to go from your thoracic cavity that's protected by your ribs to your cranial cavity that's protected by the bones of your cranium. And so these vessels are going to travel through the transverse processes. So only cervical vertebrae have them. They have transverse foramen. And then again, C1 is the atlas and C2 is the axis. The axis is actually called the dens or odontoid process. So I'm thinking that here's a structure that's superior, but when we look at the sides, this is C2 and this is C1, and this right here is the axis that sticks up off C2. C2's axis. So you can see that. Right, here's the axis. And so C1 can kind of pivot on C2, so you can swivel your head around. So that's good. So this is showing you cervical. Thoracic, there's no transverse foramen, just transverse processes, but you do have this little facet, smooth area where the ribs articulate. And so that's the costal facet. Lumbar doesn't have a costal facet. They're the big kind of heavy lifters down on the bottom. And so they tend to be bigger with bigger spinous processes because bigger muscles attach here. These transverse and spinous processes are areas where there are muscles and ligaments attached. So they're going to be bigger or smaller depending on how many muscles and ligaments in that area. Sacrum is 5 fused vertebrae, and you can see here's the superior articulating processes. And these foramina are formed because there's spaces between what used to be the transverse processes, right, and the spinous processes. And so they're the sacral foramina, because there's plural, right? So sacral foramina. The auricular surface is the surface that articulates with the pelvic bones called the os coxae or the ilium, the iliac bone on both sides. So that's the auricular surface that articulates with the iliac bone. The median sacral crest is here, and that really is the spinous processes fused. What other on the, really this is the anterior side. You have what are called transverse lines or ridges. This is just showing you where the bodies fuse together. Apex is kind of the point, and the base is up top, and the ala are just kind of these upper wings here. There is a little bit of a canal or hole, and that's called the sacral canal. So that's up top here. The sacral prominence is kind of this bump that you feel here if you're working in a and an ER, and you need to do a lumbar puncture or spinal tap. You always feel from the ala and the sacral prominence, and then you count up vertebra, because generally you will pull the cerebral spinal fluid out between the fourth and fifth lumbar vertebra. So you can kind of count up from the sacrum to find where that is located. Okay, thoracic cage. Remember, there's a thoracic vertebra is attached to a rib. That's what makes it a thoracic vertebra. So there are 12 thoracic vertebrae, and so there are 12 ribs. And so they're just numbered from your first rib down. It's important to mention, that true ribs are 1 through 7. And why is that? Well, all of these ribs have cartilage. And so this is cartilage that attaches directly to the sternum. And 7, right? So all these ribs attach directly to sternum. So true ribs attach directly to sternum. False ribs have cartilage, so that would be 8, 9, and 10, and they have cartilage that attaches to the cartilage of rib 7, and so they do not have direct cartilage attachment. Then you have ribs 11 and 12, and they're floating. They don't attach to anything. They actually don't connect at all. And so those are the 12 ribs. One side of the rib has a straight cut because it attaches to cartilage. And so that is called the costal end because it attaches to costal cartilage. The vertebral end of the ribs have this tubercle of the ribs, and they have the neck and head that kind of attach to that costal facet. And then there's also a transverse costal facet. So the costal cartilage end is pretty straight edged. The sternum, you have the manubrium, you have the body, and then you have the xiphoid process. Those are the 3 parts of the sternum. So sternum is here. The manubrium has this notch up here, and so that is referred to as the suprasternal, because it's superior on the sternum notch, right? Because it's notched up. It used to be called the jugular notch. So some people still refer to it as the jugular notch. It's at the top of the sternum. The xiphoid process down here is that little pointy thing you're trying not to break off during CPR. It's at the base of the rib cage. And so that concludes chapter 6. We'll talk about this when we get together, and then I will go over the appendicular skeleton in chapter 7.